teach you everything you need to know about the Nclex in 90 seconds. The test consists of a minimum of 85 questions and a maximum of 150 questions that you need to take within a 5-hour time period. So out of those 85 questions, 18 of them are going to come from 3 separate case studies. So what kind of questions are going to even be on the exam? Well, let's go over them. The first question type is going to be this select all that apply. You probably heard of it already in nursing school. But the good news with the next generation Nclex is that there is partial scoring. So that means even if you got 2 answers right and 1 was wrong, you're still going to get credit for the questions that you got right. The next question type is a drag and drop. You're going to get all these answers over here and you got to put them in the box with the appropriate steps. Just make sure to know that you don't have to use all of these answers over here because not all of them are correct. Question type is matrix style. So you're going to get like 2 to 3 columns and you got to pick out, example, which findings are appropriate for which diagnosis. All right, the next question style is a drop down. So you're going to read this paragraph first and then you're going to get some questions where it's going to have a drop down menu of answers and you just pick out which one is the most appropriate. Here we have a highlight. So again, you're going to read a paragraph and you're just going to highlight what information is critical. And then finally we have bow tie. So when I took this question, I remember I started with the blue column of potential conditions and then I chose what action should the nurse take and the parameters to monitor. Finally, just remember the Nclex is a safety test, so brush up on prioritizing patients. So remember acute, unstable, newly diagnosed, those come first. Safety precautions, medication antidotes, and toxic levels, stuff like that. Also get this free cheat sheet and watch this video because I think it'll really help.